Welcome back to the Conquer Your PCOS Naturally podcast. I'm Dr. Rebecca, and today we're diving into a topic that touches many lives, yet is often misunderstood: getting a PCOS diagnosis. Whether you're newly diagnosed, still searching for answers, or supporting someone on this journey, this episode is for you. Let's start with a question. Have you ever felt lost, frustrated, or even relieved when hearing the words, "You have PCOS"? If so, you're definitely not alone. And today, I'm going to walk you through the diagnosis, what the signs really look like, which symptoms should be considered red flags for the possible presence of PCOS, several myths, and, most importantly, what to do next. So let's begin with the basics, because if you're going to understand your diagnosis, you need to know what PCOS actually is. PCOS, or polycystic ovary syndrome, is a common hormonal condition that affects folks with ovaries of reproductive age. And when I say common, I mean really common. A 2020 study titled "The Prevalence of Polycystic Ovary Syndrome, a Brief Systematic Review," published in the Journal of Human Reproductive Sciences, found that the average prevalence was a staggering 21.27%. The authors found that the proportion of women with PCOS also increased in the last decade. Yes, their research estimates that around 1 in 5 women and ovaried folks has PCOS, and that the rate is on the rise. Now, here's something that surprised me when I first learned it. Research shows that PCOS doesn't affect everyone the same way. Ethnicity and environmental factors influence how PCOS presents. Hispanic women, for example, tend to experience more severe hyperandrogenism and metabolic symptoms. Studies have found that Caucasian peeps are less likely to develop PCOS compared to Middle Eastern and non-white populations. This tells us we need more culturally sensitive research and care that recognizes these important differences. So why does diagnosis matter so much? Because understanding what's happening in your body is the first step to healing physically and psychologically and, to my mind, spiritually. PCOS can affect anyone with ovaries, regardless of background or body type. But getting that diagnosis can be where things get frustrating. See, if you felt like it took forever to get answers, you're not imagining it. The statistics on this made me angry when I first read them, though they didn't surprise me. There is often a long journey to an official diagnosis. As a 2023 article titled "Challenges in Diagnosis and Healthcare in Polycystic Ovary Syndrome in Canada, a Patient View to Improve Healthcare" said, quote, "A PCOS diagnosis occurred on average 4.3 years following awareness of first symptoms and required consultation with more than one primary care provider for 57% of respondents. 53% of respondents reported not receiving a referral to specialists for follow-up care, and 70% were not informed about long-term health morbidity such as diabetes or cardiovascular disease. Most respondents, 82% in fact, did their own research about PCOS using online sources, academic literature, and advice from peer support. Research shows that more than 1/3 of women wait over 2 years for a diagnosis, and nearly half see 3 or more health professionals before being diagnosed." End quote. Think about that for a second. Most women and ovaried folks have to wait for over 2 years before they receive a diagnosis. That's a long time spent wondering what's happening in your body. In particular, waiting to understand why you're struggling to lose weight, being unable to regulate irregular cycles, and finding it impossible to improve fertility and become a parent. The World Health Organization also estimates that globally up to 70% of affected folks remain undiagnosed. This can leave you feeling isolated, confused, or even doubting yourself. Although I was technically diagnosed quickly, I remember the years of uncertainty and the relief, mixed with overwhelm, when I finally got answers. If you're in that place right now, please know you're not alone, and you deserve clear, compassionate answers and care. So let's talk about how PCOS is actually diagnosed, because understanding this process can help you understand and advocate for yourself. The widely used guideline for the diagnosis of polycystic ovary syndrome is the updated Rotterdam criteria. Now, don't let the technical name intimidate you. It is straightforward. According to these criteria, you need 2 or 3 of the following. The first is irregular or absent periods. That means menstrual cycles longer than 35 days, fewer than 8 periods a year, or missed periods altogether. The second is signs of clinical androgen excess, often referred to as excess male hormones, like excess hair, acne, or an elevated level on a blood test. The third is polycystic ovaries on ultrasound. This means that over 20 partly developed eggs are visible in your ovaries, or that the ovaries are enlarged. And here's something that confuses a lot of people. You don't need to have cysts in your ovaries to have polycystic ovary syndrome. I know, the name is misleading, right? Only 2 out of 3 criteria need to be fulfilled, and any other conditions that could explain the signs and symptoms should be eliminated. Alright, let's get into the part you're probably most curious about, the symptoms, because recognizing these signs early can change the journey. Here are common, overlooked, and red flag symptoms. Some of these are obvious, but others are easy to miss or dismiss. The common signs and symptoms include irregular periods, cycles longer than 35 days, fewer than 8 periods a year, or missed periods altogether. If you have irregular periods, PCOS should be considered a possible reason until ruled in or out. Weight gain. Are you struggling with weight gain, especially around the abdomen, and find it incredibly hard to lose weight? This could be a giveaway. A 2024 study called Diagnosis and Management of Polycystic Ovarian Syndrome noted that, quote, people with PCOS are more likely to be overweight or obese, that is 53 to 74%, than those without the condition, and higher body mass index, BMI, is associated with more severe symptoms of PCOS. End quote. Acne and oily skin. We're talking persistent breakouts, especially on the face or back. Excess hair growth. This is called hirsutism. We're talking coarse or dark hair in places like the chin, upper lip, chest, or stomach. This is a red flag, as according to the study, prevalence of female hirsutism and PCOS in the United States, a cross-sectional study, folks with PCOS are around 14 times more likely to experience hirsutism when compared to those without PCOS. Scalp hair thinning. In a cruel irony, PCOS can cause hair where you don't want it and the loss of hair where you do. That said, what other issues might indicate the presence of PCOS? Fertility challenges, difficulty becoming pregnant due to irregular or absent ovulation, and greater trouble maintaining a pregnancy. The risk of miscarriage is higher in PCOS. Fatigue, a deep, persistent tiredness even after sleeping well. Mood changes, anxiety, depression, or mood swings that seem to come out of nowhere or feel intense. But it doesn't end there. You might also experience skin tags, small, soft, benign growths that hang from the skin on thin stalks. Darkened, velvety skin patches, especially in body folds, called acanthosis nigricans. Sleep disturbances. The study, Role of Obstructive Sleep Apnea in Metabolic Risk in PCOS, noted that obstructive sleep apnea is common in adults with PCOS and is the most common sleep disorder in this syndrome. Pelvic pain is a common complaint. And if you experience strong sugar cravings or gut issues, these are common too. Now, I want to pause here and talk about something we don't discuss enough, the emotional side of this. Getting a PCOS diagnosis can bring a tidal wave of emotions, relief, frustration, confusion, even hope, sometimes all at once. One minute you're relieved to have answers finally, and the next you're Googling PCOS cure at 2 a.m., feeling overwhelmed by everything you're reading. It's okay to feel whatever you feel. What matters is knowing you're not alone, and that support and information are available. Which brings me to something important. Myths. Before we move on to what to do after a diagnosis, let's clear up 3 myths that might be making this journey harder than it needs to be. Myth number 1, you need to have cysts to have PCOS. Not everyone with PCOS has cysts. Myth number 2, it's just about weight. Absolutely not. PCOS can affect people of all shapes and sizes. I've worked with very slim folks who have severe PCOS, In these cases, I've found high stress is usually a pressing factor. And the most important myth, it's your fault. Just to be clear, PCOS is not your fault, and you're not broken. Let me say that again for those not listening carefully. It's not your fault and you are not broken. Okay, so you've got a PCOS diagnosis. What now? Let me share 3 practical first steps. First, track your symptoms, and if you have one, track your cycle. I know this might seem basic, but this data is incredibly valuable. Understanding your body is a great starting point, and this will help you do that. Then, as you implement different treatments, track your progress to see what works for you. Second, seek out evidence-based information, like this podcast, reputable scientific sites, and resources that aren't trying to sell you magic pills or miracle cures. And third, connect with a supportive community, because you shouldn't have to figure this out alone, scrolling through conflicting advice on the internet at midnight. And speaking of community, if you're looking for support, we'd love to welcome you to our complimentary closed group at facebook.com/groups/conqueryourpcos. Share your story, ask questions, and know you're part of a community that truly understands. Before we wrap up, I want to leave you with this. Your journey is valid. Your symptoms are real. Your frustrations are justified. Thank you for joining me today. Until next week, take care of yourself and each other.